Hello, this is Dr. Gil Winkleman, and welcome to my webinar, part of the Ask Dr. Gil podcast series. Today, we're going to be talking about folates and anxiety, and why folates sometimes make anxiety worse, and the challenge of finding the right supplements. The overarching topic is how to treat anxiety without medication. And anxiety is a massive problem in the world, but in particular in the United States, where over 31 million Americans, approximately 10% of Americans are affected by anxiety. That's probably undercounted, particularly since COVID. And I know a lot of anxiety is situational, and just reading the news can make someone anxious. Today, I want to narrow the topic down into issues with MTHFR and anxiety and vitamin treatments for it, because I've had many, many patients or people tell me over the years, I have MTHFR, I need to folate, and I feel worse. And one of these patients that, well, I'll call her Lauren, she went to a functional medicine doctor, and the doctor did an MTHFR test and said she's an undermethylator and put her on methylfolate. Now, to be fair, I learned that in medical school as well. And the information is just not correct, or it's maybe a better way of saying it is incomplete. And Lauren took the methylfolate religiously for 2 months. And for the first, say, 6 weeks, she felt great. She's like, wow, this is a miracle. And after that, she started feeling worse than she did before she came in to this doctor. He said, well, maybe it's heavy metals. And then they tried treating that, and she continued to feel worse. And so they tried to treat Lyme. And not to say that those are bad things to do. They are definitely important, but really the issue was the folate. And when she came to me, we ended up, as it happened, we completed the heavy metal treatment, but we took her off the folate, and she started feeling a lot better. So who am I? I'm Dr. Gil Winkleman. For those of you who don't know me, I'm a naturopathic physician. I'm licensed in Oregon and Hawaii. I have a master's in counseling psychology, studied genetics at UC Berkeley, and was personally involved in Human Genome Project. Over the last 20 years, I've helped thousands of people with mental health issues, including anxiety and depression and other conditions as well. I mostly focus on mental health these days, although as you'll see and we'll talk about a little bit, a lot of things that show up in the nervous system sometimes are actually starting somewhere else in the body. And I'll touch on that towards the end. And for those of you who don't know what a naturopathic doctor is, there's basically 6 tenets to being a naturopathic doctor. We're trained as primary care doctors, and I happen to go to a medical school in Oregon. Oregon has, for naturopathic doctors in Oregon, have one of the broadest scope of practices available, because we can prescribe pharmaceuticals, we can do botanicals, homeopathy. In Oregon, we can do adjustments and minor surgery too. Very few people do all of these things. Like, there's just too much information. But the tenets behind it are important. And they're important in terms of the vitamin therapy. You treat the whole person, you find the underlying cause, and you use the healing power of nature. Now, there's also do no harm, which is similar to medical doctors and osteopathic doctors. Doctor is teacher, and prevention also, those are really similar as well. But it's these that I want to focus on, because treating the whole person is really important, and finding the underlying cause is really important. One of the situations I treat is something called pyrrole disorder. And in pyrrole disorder, one can have issues with inflammation that are causing mental health symptoms. The thing about it is pyrrole disorder is not a condition in and of itself. It's really just a sign of oxidative stress in the body. When you're finding the underlying cause, you want to find what's causing the oxidative stress to make that better. And then maybe you don't need to take the supplements anymore. That's kind of the piece about that I think is really important. And the other piece, healing the healing power of nature, is important because I think vitamins are something that our bodies should be getting. And we, because of diet, a combination of diet as well as food supply not having as many nutrients in it, I think these are important pieces to understanding this. So let's talk about folate and anxiety. And I've been doing this for a long time, and I want to talk about a couple of the things that I've learned about folate over the last 15 years, and looking at the Walsh protocol in particular, which I'll touch on a little bit. And why I don't really prescribe it very much. So the sort of the thought process behind this, and you see the big arrow. This is the two sides of the methylation cycle. Actually, there's more to this diagram than just what I put in here, but this is the two sides that are important in this discussion. So you've got the folic acid on the left, and that tetrahydrofolate becomes 5,10-methyl-THF. And the 5,10 MTHF reductase is the MTHFR, which makes 5-methyl-THF. I just realized I put the arrow at the product, not at the enzyme. And so folate, giving methylfolate, the idea is if you have an MTHFR quote unquote defect, it's really not a defect. It's really a variant. If you have the MTHFR variant, you're not producing as much 5-methyl-THF as you would be if you didn't have the variant. And that is true. And so the thought process is that if you're low in 5-methyl-THF, your homocysteine, which is on the right side of the diagram, gets high, and that blocks methylation from being activated properly. The science of this looks at this, and it actually kind of makes sense when you look at it, but that's not how it works. And part of the problem, there's a bunch of different issues, but part of the issue is the testing. So one thing, testing isn't always accurate, particularly when looking at SNP tests. Why? Well, when you look when you're looking at the entire genome of the human body, what's going on is you're sequencing every single position in there, which is, I think, 1 trillion base pairs, and you're looking for one of those that's wrong, right? That's really a needle in a haystack. If you were to run through all of, let's say, 5 times, you're not going to get 5 answers because, well, you could. I mean, you could get different variants, right? But there's mistakes in the process that can happen. So to do it right, it needs to be run about 1,000 times, is what I've been told by geneticists. So, and calibrated, if you will, as well. So there's that issue. The other issue is that the SNP tests assume every cell in the body is the same, which we know is not the case, because that's how we get cancer, right? Because cancer cells they actually can have different DNA being activated because of mutations, right, that happen. So there's that. The other thing is the MTHFR gene is actually a very large gene. And as a result of that, one change or 2 changes has less impact than, say, in a product like the sickle cell gene, which is a much smaller gene. So I'm going to talk about some of the patients that I've worked with looking at this, Jesse being one of them. I'm not using any real names, by the way. This was a patient who started taking folate, much like the first patient, Lauren, because of the MTHFR test. The difference is Jessie felt worse right away, as soon as she took the folate. And so what she was told was, well, you need to do folinic acid. So she tried that, same result. She tried folic acid, same result. She tried non-methylated forms, same results. And what happened with her is I gave her the treatment from Dr. Walsh's perspective, which is the undermethylation treatment. And she started feeling better within a couple of weeks, which is actually fast for that treatment. And Jessie's doing great, and she avoids folates and been doing really, really well for several years now. As an aside, with obsessive compulsive disorder, I've had patients who, if they have folate in a bowl of cereal, they will feel worse. Most cereals are enriched with folic acid of some sort. And so that's something that was really interesting to me. That was not something I knew when I started going down this road. I had talked to this patient because I thought he did need folate. And I said, hey, can we supplement with a little folate? And he says, if I have a bowl of cereal in the morning, I feel worse. I feel bad all day. I'm like, okay, well, we'll find another way through fixing the homocysteine issues. So a lot of this stuff, by the way, is the work I've talked about, the Walsh protocol. If you don't know Dr. William Walsh, he has a book out called Nutrient Power, which is about exactly kind of what we're talking about, but he goes into a lot more detail. And the Walsh Institute puts out research, and I'm a certified Walsh practitioner. I forgot to tell you. When you look at a situation with a patient, the diagnosis, the medical diagnosis is important, but it's not the determinant factor necessarily in terms of the treatment. And this is kind of an interesting piece, because it kind of turns the way that we look at this on its side a little bit. And really, it's about epigenetics in a lot of cases, as well as inflammation. The biosubtype that a person is more important than the diagnosis in a lot of cases. Not always, but in a lot of cases. So what are the biosubtypes? There's an undermethylator, there's an overmethylator, high copper, low zinc, and pyrrole disorder. Now, you can have more than one of these, but you cannot have low zinc. Actually, you can't have low zinc and high copper. You cannot be an undermethylator and an overmethylator. That's not possible in this framework. You can be someone who will sometimes have an issue with methylation and go between the two, but you're not an overmethylator or an undermethylator in terms of Walsh. Now, I'm going to touch upon this a little bit. It has to do with epigenetics, and I'll get to that in a minute. Now, my experience in Walsh started with autism. And back in, I don't know, it was like 15 years ago, I had a lot of autistic patients. And, it was really interesting because I was doing neurofeedback at the time. And many of them would improve with the neurofeedback in certain ways, but there were certain things that wouldn't get better on their own. What I started trying the Walsh protocol, and what I learned is most people with autism are undermethylated. And so once I started treating the undermethylation with the neurofeedback, we saw, big strides. Now, it wasn't like it went away, but definitely a lot of the issues that the parent, usually it was parents, were complaining about, whether it was stimming or sleep issues or allergies, those were getting better. And that was really interesting to me. So as an example, I had this patient, Jimmy. He had lots of issues, behavioral issues, sleep problems, allergies. The neurofeedback helped a lot. What was really interesting was that his allergies didn't improve with any of my treatments. And at that time, I would have a really good success rate treating allergies. And for whatever reason with Jimmy, they would not get better. So I treated them using Walsh protocol, and lo and behold, they got better within say 2 weeks. It's really kind of amazing to me. And that was one of the things that was like, okay, I need to go deeper into this, down this. So there's other things that can affect methylation in terms of both, and I'm going to get to this, both in terms of the methylation cycle, but also if someone's being an over and under methylator. And inflammation and gut issues are big ones. Hormones are really interesting because the way we remove a lot of hormones is through a methylation process. So one of the things that's kind of interesting about this is that the term methylation is used in multiple ways. One of the ways that it's used is the methylation cycle that I showed you. One is used in terms of how are products removed from the body. So when you have something, let's say histamine, for example, the way we remove histamine is the body will take a methyl, which is basically a carbon with 3 hydrogens on it. That's a methyl. It's a hydrocarbon, smallest one, and it attaches it to the histamine. And then there's an enzyme that comes by and cleaves that back into its amino acid state, and then deals with the methyl in another way. But it needs the methyl to be able to recognize it too. It's basically like tagging it saying, hey, remove me, So that's kind of the idea behind methylation. Well, methylation is also a key component or key idea in something called epigenetics. So epigenetics is really important. I'm not going to go into great detail about it at the moment, which I'll tell you what I'm going to do, though, in terms of other offerings in terms of epigenetics, because it's such an important piece that and methyl is a key component of how this works. So epigenetics basically is how DNA gets turned on and why DNA gets turned on at a particular cycle in your life, right? So the cell, we have 23,500 genes roughly in our cells, but not every cell uses every gene, and certainly not at every time. Epigenetics is basically that the DNA knows what to turn on when. It's kind of how we are able to respond to our environment. And when we're in similar environment, we will tag things in a way so that it's repetitive. So we know when to get this out of the system, right? So, I use the analogy that if you took all the railroad tracks in the United States and shoved it into a 10 by 10 room, that's basically what we're doing with DNA inside the nucleus. Because the amount of DNA that we have, if you were to string it into one line, would go 10 feet, 3 meters, which is staggering when you think about the size of a nucleus, which is, minuscule, right? Microscopic. And so the issue that happens for people is that when you get into a certain state, you want to tag something as something that you either use a lot or you don't use a lot, right? So in the analogy about railroad tracks, if I were going from Seattle to Portland a lot, I'd want to tag that, hey, I go there a lot, so it'd leave it out. And if you had, say, Chicago to LA, you don't do that very often on a train, at least not on a passenger train. So you tag that as, I don't use this very often, and keep it stuffed in there. Because basically the DNA is spooled into these tight little balls, and then there's little bits of it that kind of stick out. And the parts that stick out are the parts that the cell uses a lot of. And so this is where methylation is important. Now, the confusion that happens is this is the way, like someone who's undermethylated, they gestated in a way where their DNA is in a particular state, and someone who's overmethylated, they gestate in a way where their DNA is in an opposite state of that. And this is kind of the confusion about this. And I'll go into that more about this. And so, there's a last patient that I'll talk about, Marion. She came to me and she was taking medication for her anxiety and depression. She tried all kinds of it, SSRIs. She had tried benzos. Nothing really helped, or if it did, it didn't do it for very long. Now, the thing about her was nothing made it worse. And so when we started to look at inflammation, we looked at her symptoms, we did some testing, we looked at that, we looked at her level of inflammation and started treating her from that perspective. She started to get better. That was really amazing. So just as a quick summary, if you walk away with three ideas here. Number one, MTHFR test does not give you methylation status, and I would argue that by itself is actually not useful. There are other providers that look at all of the genetics. So they'll look at MTHFR, they'll look at MTRR, they'll look at CBS. I'm throwing terms out, I know, but it's all part of the methylation cycle, and they can kind of making a determination based on that. Whether they're right or not, I have no idea, actually, because some of my patients have said, oh, I went to, I used that methodology and it worked great. And I've had other people who said I used that methodology and it was a waste of time. So it's hard to know. I think there's something there. I just don't know what it is. So that's the first thing. The second thing is folate can definitely create more anxiety for somebody by itself. And the third thing is epigenetics is super important in regards to this. Okay, so I want to introduce one of two new courses that I'm offering. This first course that I'm going to tell you about is a shorter course designed for people in terms of having folate issues and wondering what to do about it. And in the course, I'm going to go through methylation in great detail and explain how it is that someone who is taking something that should be helping them might not be helping them, because some of the issues with folate are that it is doing the opposite of what you've been told. And part of that I'll explain in the next module, which is epigenetics, because the epigenetics piece kind of explains the process with folate, because folate is affecting our epigenetics separately from methylation. And so once you kind of understand those two things, you can understand why just having MTHFR doesn't mean you need to take methylfolate. And I'll go through some of the SNPs to explain which ones are significant or not significant. I'll also talk about what to do when you have a reaction, because the problem is that you may be having a reaction to the folate, but you may be having a reaction because of something else related to the folate. And I'll go through that decision tree as well. Finally, I'll talk about what other vitamins to use, because sometimes the issue isn't the folate, it's that you're deficient in something else, and therefore the folate can't be utilized properly. And I think these topics are super important because I think that we assume that there's a one size fits all, and that's including MTHFR. I mean, what's interesting is even with people who have the C677T homozygous issue with the MTHFR gene, they don't all respond the same way. And we don't understand why that is. There are tendencies because of that situation, but that doesn't mean it's a sentence. So, and then I will cover some FAQs in this as well. The goals of this course are to understand methylation and epigenetics and what vitamins might be useful in helping if you have an issue with folate. Now, I have a bigger course that I'm offering. It's dealing with more things. I look at testing. I look at the role of other vitamins. I look at other causes of anxiety and mental health issues, but it's not specific necessarily to the folate issue, but you feel free to check it out. Here's the link for this course. I'm calling it the methylation mini course, as well as the why folates make me anxious. And there's a lot of information in there that you can pick up to find out more about how to help yourself regarding the methylation cycle. And I'm offering it right now at an introductory price of $37, which is fairly inexpensive for a course that's this comprehensive. So I hope you check it out, and I hope you got something out of this webinar as well. Thanks so much. Have a great rest of your day.